Symone Sanders, Senior Advisor to Vice President Kamala Harris. Thank you for your time. Before we talk about vaccine equity, let's talk about the updated rollout plan. We know the administration's plan of 100,000 doses, essentially 50 million people in the first 100 days. At last check, the CDC had reported to date, only 32 million Americans have received at least one dose, including those vaccinated during the Trump administration. So with these new variants now at play as the virus mutates, are you still confident you're going to meet your goal?
We are confident we're going to meet our goal. And look, the reality is, and Jeff Zients, the White House COVID coordinator, and the president have spoken about this most recently. The reality is that the president and vice president understand the need to get vaccines to communities because, as the president and vice president have often said, vaccines don't save lives, vaccinations do. The goal is to get vaccinations into arms. And in places like North Carolina, we know that the need is great. That's why the administration just increased North Carolina's vaccination dose by 5% this past week. And that is also why they've made the commitment of getting 200 million more doses of the vaccine to communities across the country by this summer. And so this is a top priority for the president, and he believes that we can get it done, but it's going to take all of us. So that is why our message is, when folks have the opportunity to take the vaccine, to get vaccinated, they should do so. Do not wait. Getting vaccinated is relatively painless and it will save lives.
So President Biden has invoked the Defense Production Act to increase supply. Pfizer just announced it is cutting manufacturing time in half. Are you concerned, though, this speed to push up an already exhausted supply could cause harmful missteps or even further exacerbate that mistrust many Americans currently feel?
Absolutely not. Look, this is what the American people want. Folks in North Carolina, I believe that they would like the opportunity to get the vaccine. And we as the federal government have to do our part to make sure that those vaccines are there and available, which is why the federal government has purchased an additional 200 million doses of the vaccine to be delivered to communities by this summer, which is why we have upped the allocation just this past week to North Carolina by 5%. Look, this is also about educating folks, having conversations such as these, going into communities, meeting people where they are, talking about the importance of vaccinations and really what it can do for communities. Look, we believe, and the president and vice president have spoken about this often, that we need to get vaccinations into arms because we want our businesses reopened and operating safely. Folks want to get kids back in school and schools operating safely. You know, I walked into the studio today with my mask and we were joking that I can't wait to take this mask off. But the only way we can do that is if folks social distance. And again, when you have the opportunity to get the vaccine, take it. The last thing I'll note here is this, that the federal government, specifically the Biden-Harris administration, understand that, states and municipalities, they want to do more, but they need a little help, which is why just this week, the administration announced partnerships with community health centers and sending more doses, 1 million doses to community health centers across the country. That includes folks in Greensboro, North Carolina, but they also announced these federally funded vaccination centers. So over the next couple of weeks, federally funded vaccination centers will be opening all across the country. Today, 3 more are opening in Texas. And that is a partnership between states and the federal government, again, to get those vaccinations into communities that need them most.
This all sounds so encouraging, but I know our viewers are going to hear this and say, well, there were 10,000 people in the queue when I tried to call my county health department. I couldn't get through. I can't make an appointment on the phone or online. What do I do? You know, the frustration here is paramount.
I completely understand that. The message from the federal government is this: help is on the way. The president and vice president understand that this is in fact a crisis that folks are dealing with across the country. So there's 2 things. First and foremost, the American Rescue Plan. The president and vice president have been talking about this all over anything that they're doing. We've had administration officials out. This is something folks are hearing from their representatives on the Hill. The American Rescue Plan is the urgent urgent relief that folks need right now. There is money in that plan for $20 billion for vaccinations so that we can get those vaccinations in arms, get schools operating safely. But we need Congress to pass that. The second thing is this: for folks who are in communities right now wondering, how can I even get the information? I talked about community health centers. Am I eligible? Where can I find that? I'm going to give you a website. You can go, and let me read it. You can go to findahealthcenter.hrsa.gov. That is a place where you can find a community health center in your local neighborhood and sign up. And if your community health center is one of the health centers that has had an increased, that is getting this part of the 1 million vaccination doses, there you can sign up and get in and make that appointment to get your vaccination.
So you did mention the rescue plan, so I want to talk a little bit about that. The preliminary plans passed both chambers without a single Republican vote, but President Biden has said he's open to negotiation, especially in targeting those $1,400 stimulus checks. Where are we at in those negotiation talks? Have they materialized?
So the negotiation talks are ongoing, and the president and vice president are committed to working with allies in Congress, lawmakers across the spectrum, to get this done for the American people. It is the president's view that, the relief that American families need is not a partisan issue. In fact, we know that this virus is affecting us all. Now, it is affecting some communities disproportionately, which is why we have been talking a lot about equity here at the White House and across the administration. But this is relief that families need all across the country. There is bipartisan support for this. 7 out of 10 Americans have said in a recent Quinnipiac poll that they want the American Rescue Plan. There's Mitch McConnell has spoken about favorably elements of the American Rescue Plan. So we believe that there is bipartisan support for this in Congress and that we can garner some Republican support. But I will tell you this, that it is not the president's intention to compromise on the boldness and the urgency of this package. He designed this package with not a number in mind, but really the need for the American people. 10 million folks have filed for unemployment insurance and are out of work. 15 million people right now across this country are behind on rental payments, and more than 12 million children are struggling to find something to eat. This is urgent, and again, help is on the way, and we believe that this package is a way to get it done.
It is urgent because of all the reasons you just laid out, but the American people, many of them can't help but feel that what is currently going on as we speak, the impeachment trial against a now private citizen, is detracting from those priorities to get this bill passed and only further exacerbating the divide between the two parties. Do you feel that way?
Well, look, Congress has a job to do, and the Senate is doing their business this week. They are doing their job, but we also believe that they can walk and chew gum at the same time. The relief that the American people need is urgent. It cannot wait. And as the president and vice president have said over the last couple of days, you've heard this often, is that we can't do too much here, but the danger is in doing too little. And so that is why it is the administration's belief that we have to pass this package urgently. We have to work together to do it, Democrats and Republicans and independents, because first there's relief and then there's recovery. In a few weeks' time, the president will lay out his recovery package, a Build Back Better plan, if you will, for jobs in the economy. But first, we need to give some relief to families and communities across the country. This is really about their survival, and we look forward to working with Congress to get this done.
And then back to the vaccines for a moment. Viewers watching this are North Carolinians who are in the last group of this phased rollout. When can they expect? What kind of a timeline? Is it going to be weeks or months? Can they expect to be able to go to their local health department or go to a local pharmacy and get that shot when they want it?
So the administration is working with municipalities and state governments across the country. Earlier this week, I believe it was yesterday, Governor Cooper was on a call with administration officials talking about the vaccine allocation. Again, an additional 5% of doses. The dosage to North Carolina has been up by 5% this week, and we look forward to doing more. It is the federal government's goal to ensure that we are giving states and municipalities enough lead time to know what their dosages will be so they can make plans for their constituents and folks across their states and territories. So we're working very hard to get this done. It won't be easy. And our chief of staff, the president's chief of staff, Ron Klain, often jokes that it won't be easy should maybe be the Biden-Harris administration motto. It won't be easy, but we have to try. And that's exactly what we're doing here.
And today, or February 10th, if folks watch this later, is when you just announced about an hour ago the COVID Health Equity Task Force. You've alluded to that a little bit already, but what's that going to entail? And what specifically are they going to do to increase trust among marginalized communities?
This is a great question. So today, the president and vice president have announced a 12-member COVID equity task force, which will be charged with providing recommendations to the administration, primarily to the president and vice president, on how to tackle these inequities that we've seen in the vaccine distribution, how to really ensure that communities across the country, both urban and rural, are getting the access to the vaccines that they need. You know, equity, the heart of it is about ensuring that we are meeting the need for specific communities. Rural communities are hurting. They are being disproportionately affected by the virus. And we have to ensure, folks in North Carolina know this well, we have to ensure that our distribution plan gets to those that need it most. In addition to instilling confidence in the vaccine in communities of color, such as African-American communities, Latino communities, and tribal communities. And the foundational, or this task force is really inspired by a lot of the work that Vice President Harris did as a senator in the United States Senate. She introduced a bill on racial and ethnic disparities in health for COVID-19 that would create a task force, and today that work comes full circle. So the task force will be hard at work until these recommendations come forward, and then the administration looks forward to operationalizing those recommendations to get this relief done for the American people.